On the behalf of Foremost Organization, we welcome you all. This is Consumers Doctor on the health financing the healthcare segment, folks. We have two segments. This is a healthcare financing, and there's another segment called HIP, Health is Platinum segments. We all have gone through the different aspects of the health insurance personalized. For us to give a final review of what we mentioned regarding to the health insurance personalized. This is a big idea, folks. This is a big idea. What are we trying to achieve? We are trying to achieve basically consumer-driven, patient-centric system. This is where the consumer demands where they can be, I'm sorry guys, welcome. This is a live stream from Consumers Doctor on the behalf of Foremost Health Organization. Foremost Organization conducts live streams. This is HIP, Health Insurance Personalized. Since we have spoken about the financing the healthcare segment, we need to go through some final recap what health insurance personalized segment is all about. Let's recap things which I've already mentioned in regard to the big ideas, where this is a consumer-driven, patient-centric system. So what were those big ideas we talked about? These workable ideas have been proposed in the past by a diverse group of politicians, including former House Speaker Paul Ryan, Newt Gingrich, US Senator Ted Kennedy. It is time we revisit the concepts with a focus on consumer and the patient needs. Focus is on the consumer and the patient's needs. First, risk segmentation. The insurance companies, right now the premiums are based on risk pooling among the entire population. They are not being segmented. So we have been talking about risk segmentation to 4 categories that will lower the premiums into well category, at risk, chronic illness, and catastrophic. So that way we can be grouped into health risks, good and bad. And we can provide appropriate level of coverage and proper medical care at affordable insurance premium by segmentation, rather than the present structure. What we have is a risk pooling among the entire public. We need to segment this into different categories. The next one is healthcare consumerism. Healthcare consumerism, your health insurance, you are a health insurance consumer. Efficient free market always respond to consumer demands for products, services, information. It is time we tried a system that focused on consumer and the patient's needs. This is one of those big ideas. We have gone through it. So this is another big idea we have been talking about in the health insurance personalized. So what are those ideas we have been talking about? So this is another thing, is healthcare consumerism. Is the consumer is in the front line, and his needs. So it's all demand based. Consumer demands will focus on different segmented risks. The other one is, third one, personalized health insurance. Personalized health insurance is a voluntary, hassle-free idea. This is a big idea, folks. Voluntary, hassle-free idea that focuses on the importance of health insurance affordability and choice. It does not mandate any plan design. With personalized health insurance, premiums are 15 to 20% lower without any mandate. Without any mandate. What is another big idea? Individual health insurance. Individual health insurance. Affordable health insurance should be guaranteed. Cover pre-existing conditions, help the sickest among us with most serious impaired health conditions. That's a big idea, folks. That is a big idea. So there is a guaranteed coverage for all Americans, irrespective of their socio-economic status, irrespective of their physical condition, mental condition. So you have a guaranteed coverage, individual insurance for everyone. Another big idea, allow this segmentation of small risk members with impaired health support plans. With impaired health support plans. When they apply and upon their renewal, this will lower smaller group health premiums by at least 15 to 20%, folks. 15 to 20%. That's a big idea. How about the large self-insured groups? Large employers need healthcare reform more than health insurance reform. Yes, more of a healthcare than insurance reform. Large self-insured groups would benefit from transparency of medical service costs, medical quality standards, tort reform to minimize excess costs of defensive medicine, to minimize the excessive costs of defensive medicine. Coffee. Nothing like having a morning coffee. Another big idea, Health Review Authority. Health Review Authority. create a health review authority to provide for fair segmentation of risk and empowerment of consumers, initially rejected for health insurance so-called uninsurable. So Health Review Authority levels the playing field for all Americans, empowering the consumer, even when they were rejected. Big idea, access to care. Access to care. Establish access to health care by first creating a better access to affordable health insurance. We need a better access to the affordable health insurance to all. That is consumer. Again, health access is consumer driven. Health insurance access I'm talking about is consumer driven. Big idea, quality of care. Quality of care is only possible when options to access to care provided through affordable health insurance. That's only possible when you have affordable health insurance. Big idea is the cost of care. What is the other big idea? Cost of the care. Cost of the care can be lowered with segmentation by health status or risks. These are group impacts and personal impact to costs. These are group impacts and personal impact to costs. Group and personal changes in behaviors can lower the use of medical services. Yes, can lower the use of medical services, lower the costs of care, reduce premiums, and offset out-of-pocket costs, because consumers decide what is good for them. Because in this scenario, they have to use their personal savings accounts. That's where your rewards and revenue, expenses. So consumers are careful to use the money from their health savings. Though the behavior will change, they will spend the money basing on what is best for them. There's nobody's telling them what to do. They will make that wise choice. What is another big idea? Financing the health insurance. Recognize that health insurance can be financed through at least 3 mechanisms. There are 3 mechanisms. One is insurance premiums. Number 2 is savings, taxable and non-taxable, HSAs and HRAs. HSA, health savings, and health reimbursement accounts, HRAs. Third, incentives and rewards. So we all recognize we can finance the health insurance by 3 different mechanisms. One is insurance premiums, one is savings, HSAs or HRAs, and third one is incentives and rewards. Another big idea, individual certificate of guaranteed coverage. This is a big idea. Individual certificate of guaranteed coverage empowers and guarantees everyone individual health insurance, even if they have a pre-existing conditions and are in need of a financial assistance, even if they're in need of a financial assistance. Segmenting uninsurable individuals to the premium subsidized impaired health support plans can lower the premiums. For others, by 15 to 20%, that will not be a burden on others. So it will lower the premiums in the well risk category. By 15 to 20%, the premiums will be lowered for the rest of the well category. Another big idea: small group certificate of guaranteed coverage. Using certificate of guaranteed coverage for smaller groups along with impaired health segmentation at application and at first renewal can lower the small group premium by 15 to 20%. These are, most of them are small business folks, small businesses. This is the engine, small businesses. This is where we need to focus our attention on, small groups. Another big idea is impaired health support plans. Impaired health support plans, enhancement of the impaired health support plans will provide maximum help, support to those most in need. So this focuses on people who need the most. Every beneficial service, assistance, and plan design options will be available to those with chronic and persistent illnesses. And we are paying attention to these folks. We are focusing on these folks. Another big idea: eligibility for impaired health support plans. What this idea focuses on providing eligibility to both uninsurable individuals and a small group members, will provide targeted support, choice of plan options, and affordable health insurance for the sickest among us. For the sickest among us. Big idea: options for the impaired health support plans. What are those options? Provide those needing impaired health support plans with insurance plan options related to their unique needs. This is a big idea. Provide them those impaired health support plans with insurance plan related to their unique needs. Another big idea: participating insurers, insurance companies, insurers who voluntarily participate with health review authority and accept certificate of guaranteed coverage will have the market share and pricing advantage for both individuals and small group policies. This is a big idea, folks. Let me say, participating insurers voluntarily participating with a health review authority and accepting certificate of guaranteed coverage will have a market share and pricing advantage for both individual and small group policies. This is a big idea. The next big idea is cost of, what is the next big idea? Cost of being voluntarily uninsured. This is a beauty. The loss of federal and state personal tax deductions, helps to finance. So these are the folks will be financing. People who don't want to have the insurance, they'll end up contributing to the financing the impaired health support plans for those who choose to be uninsured but will eventually be uninsurable. So when you voluntarily don't get the coverage, don't buy the insurance, federal and state personal taxes, deductions, you lose those deductions. So it generates more revenue for federal and states, so they can help to support the impaired health plans. Finally, funding the Health Review Authority. This is a big idea, folks. Funding the Health Review Authority and the impaired health support plans. This is a big idea. Health Review Authority should operate as self-sufficient. Health Review Authority is a self-sufficient entity, deriving operating funds, multiple memberships, and processing fees. So there's a membership fee for the insurers and members alike. So there is a processing fee for both the insurers and the members and applicants. The impaired health support plan claims will be supported by the commission's tax deduction plan. Actually, tax deduction losses. Individuals lose the deduction, so the state and federal government will be collecting more revenue. Charity donations coupled with state and federal subsidies. I wanted, because this is a big idea. How do we support Health Review Authority? Health Review Authority should be self-sufficient, deriving operating funds from multiple membership and processing fees from the members and the groups. Impaired health support plans under the Health Review Authority. Claims will be supported by commissions. All the claims insurers submit to the Health Review Authority, they'll be supported by commissions, tax deduction losses, charity donations, coupled with state and federal subsidies. These are the big ideas we have been talking about. This is a unique opportunity for Americans to be empowered. This will be a unique way of empowering Americans for their personal protection of their own asset. This is an asset, folks. You need to take care of your asset, and you have incentives and rewards. If you participate in the incentives, you not only make money, you will be independent, financially independent as far as the healthcare is concerned. So you will not be receiving any surprise medical bills. You don't have to bankrupt. You don't have to go through all the hassles. Right now, we are going through. People, they get surprise medical bills. And this billing system has to be changed, because once the consumer demands it, the cost of the care will go down. That's the only way you can bring down the healthcare cost, folks. We are spending $3.8 trillion. Empower the consumers, which will drive down the cost of the healthcare. For the first time, we are spending more money than the national defense budget. The so-called, all these health plans, in Washington, when they talk about healthcare, they don't really mean healthcare. They talk about control. This is what Obamacare, this is what the Affordable Care. They want to control you. This government subsidy, so-called government one-size-fits-all approach. But in this scenario, consumers are empowered. Consumers are driving the cost down. Consumers are lowering the premium. Consumers are finally demanding the affordable care and affordable premium, and they will be shopping, and they have all the tools they need, and government job is to facilitate them. As Ronald Reagan said, government is a problem, folks. We need solutions. Half the time, government is a problem. We need to come with the solutions, give the tools what the consumers, Americans need, so they can be totally free from shackles of this healthcare nightmare. We all want to be free in healthcare. We need to drive the cost, and consumers are good at driving the cost down. Look at the retail, look at the food industry. Everywhere the costs have come down, but not in healthcare, because consumers are not in the front line. We need to focus on the consumers being in the front line, and government job is to facilitate. Give the tools what they need. They're not asking for your handouts. They're asking if they can get the health care what they need. And we have a way to give the health care, not by one size fits all. Consumers, we are a diverse group of people. We can't force upon them to be in one size fits all approach. If we want to be number one, consumers will demand, will make this country great. Our country is based on consumer demands. And we rely on the consumers. We rely on the Americans. Americans know what is best for them. Give them empower them what they need. Even the Medicare is bureaucratic nightmare. Medicare is wasting money. Medicare payments are bogus. They're not the true number. The CPT, DRG codes need to be gone. And stop spending money, the Medicare, Department of HHS, if you're listening, stop wasting money on the intermediaries. Intermediaries, the very first thing they do is they want to curtail the care. They want to cut down the care, take away the care. This is not right. This managed care organization, very first thing is they want to profit at the expense of you Americans. We want that control back to you, not the intermediaries. And look at the Sutter Health, what they have done. Listening to the 60 Minutes, folks, it is unforgivable. A non-profit institution like Sutter Health is controlling the healthcare under the banner of a non-profit. That's shameful. That is shameful. They're charging for pregnancy $650,000. It's unheard of. Unheard of. They're taking away the competition. We want more competition, not consolidation. They bought out all the small hospitals and they're stifling the competition. This can't happen. We need to go after entities, establishments like Sutter Health. It is shameful. You guys need to be shameful for what you have done to the healthcare. You're driving the cost up instead of lowering the cost. If you're a non-profit organization, you should be ashamed of yourself for doing what you're doing. Sorry, at the end of this week, I I get emotional, folks. I'm sorry. I don't mean to, but when I hear these stories of some of these entities, stifling the competition, consolidation, and benefiting, and they're using all the loopholes from the nonprofit, and they're not helping to lower the premiums. They're raising the premium. They're totally opposite of what it's supposed to do in the nonprofit. This is Consumers Doctor on the behalf of the nonprofit, foremost organization. We want to lower the premiums, not to raise the premiums. We want to lower the costs, not to raise the cost of the health care. We want to take away those billings, stupid billings. We want to pay as we get the care. I hope we succeed with these big ideas about health insurance personalized, so-called HIP. And we also want to educate Americans on health care, how to take care of themselves. Health is platinum, folks. It's a HIP. Health is platinum. Health gives wealth. Let Americans empower themselves to take care of their health. This is what we need in America. Not one size fits all. Thank you, guys. If you like this channel, subscribe, share, and touch that bell. Salute you all. We'll see you in the next episode. We'd like to thank, on the behalf of HIP, Health Insurance Personalized. This is Consumers Doctor on the behalf of foremost organization. Thank you. I love you all.